Hello, and thank you so much for joining our conversation today. For those of you that don't know me, my name is Kylie, and I'm a birth doula based out of Los Angeles. I also provide postpartum services and birth photography services, as well as virtual services for women throughout their preconception and pregnancy journeys. I'm honored to be here today to chat with Dr. Jessica Chen. She's an amazing Doctor of Oriental Medicine based out of Santa Monica, and I've known her for many years. So, the reason we're having this conversation today is oftentimes women are recommended to seek out traditional Chinese medicine, whether they're preparing to get pregnant, trying to get pregnant, they are pregnant, they just had the baby, or and beyond. And I think it's really important to understand how this medicine works. I'm a big believer of having intention behind every action and being an active participant in something and bringing consciousness to what you're doing to really connect your mind and body so that you can get the optimal results. So, Jessica, I would love if you could just introduce yourself, as maybe walk us through the philosophy of traditional Chinese medicine.
Hi, thank you so much for inviting me to have this conversation. I am Jessica Chen and I practice here in Santa Monica. And I've been practicing traditional Chinese medicine since 2005. So it's been a while.
Time.
But it feels like it was just yesterday that I started. Um, so traditional Chinese medicine, actually, a lot of people know here in the US as acupuncture mostly because that's what it's most famously known for, acupuncture. But acupuncture is actually part of traditional Chinese medicine. And traditional Chinese medicine, which you call in short TCM, dates all the way back 3,000 years. So it's been a while, and it's used to treat, diagnose, prevent medicine. And there's different modalities that we use. So one of the big ones, as I just mentioned, is acupuncture. We also use modalities like moxibustion. We use Tui Na, which is push and pull, kind of like acupressure massage. And we also use electrostimulation. We use guasa, which is scraping the sand, as we translate guasa is, and also cupping as well. So that's all becoming, and actually seeding. So that's a lot of I've been seeing a lot out here now to see how Chinese medicine is actually not just acupuncture now, also it's being practiced, like the cupping and the guasa and the ear seeding. So it's actually really nice to see that. So acupuncture essentially, and Chinese medicine, it essentially works on balancing your body system. So in Chinese medicine, we look at your body as a landscape. So if the water is flowing, your soil is moist, the sun is beaming, then you're healthy. Instead of in traditional allopathic medicine, views medicine kind of your body almost kind of like a machine. So okay, that's not working, we got to fix it. But with Chinese medicine, it's almost like an art form, and we focus on making sure your qi, vital energy, is flowing, your blood is flowing. When that's all working, your body's in balance, and then your body is functioning at optimal level. So that's how Chinese medicine treats the body.
That's amazing. And thanks for that great explanation because I think the key word there is balance instead of something's right, something's wrong. It's just achieving balance. And so one of the pillars being to achieve balance. And how does, especially if someone's looking to get pregnant, let's start with that, right? So someone's preparing to get pregnant, they're trying to get pregnant. How does acupuncture help achieve the yin and yang balance? So what's being done? So instead of just, getting poked with a bunch of needles, like what's actually happening when someone's doing that?
Well, one thing I really love about Chinese medicine, practice Chinese medicine, is very individualized. So everybody comes in with a story of their body and their history. So I love kind of being a detective and asking questions and see what's going on. If you're coming in and you kind of have been healthy, feeling really good, and we talk about your periods, everything is working well, then maybe if you haven't been, if this is your first time trying, you haven't even tried, then we just kind of worked on what aspect of your system needs to be tweaked a little bit.
Mhm.
And then if you're coming in trying to get pregnant, you haven't been successful for 6 months or more, and depending on your age, we kind of dive deeper. We ask lots of questions about your menstrual cycle and what you're eating, how your sleeping habits are. And that way gives us a better idea of how to treat your system. So let's just say someone has a painful period. So something is going on with their blood flow, for instance, or maybe the way their hormone is not regulated. It's not in balance, like we talked about. And acupuncture is really great at treating, restoring your hormonal balance. So, and Chinese medicine brings the nutrients to your body. So it really depends on what your what your history, what you're coming in for, and to really help optimize your body's function so it could function better. So when your body is actually not um, feeling under stress or whatnot, it really could focus on your fertility, your
Okay, great.
reproductive function.
Yeah, that makes sense too, because also the aspect for those of you who've not gotten acupuncture, it's very relaxing too. So I imagine even just having some sort of treatment, so to speak, of something where you are in a really like safe, relaxed atmosphere where you're really calm. And again, I always talk about incorporating that aspect of including your mindset, like what's going on in your mind when you're kind of lying on this table, like forced to relax and letting your body do its thing. So I think marrying the two is such a beautiful thing, and really helps people. So, okay, so we talked about how to achieve that balance. So let's say, for the women coming in that are having fertility challenges, how is this really supporting them to kind of be able to get pregnant?
So what you just mentioned, it's coming in and just kind of getting restored. I
Yeah.
think that's one huge aspect of how acupuncture could really help women that are trying to conceive or thinking about conceiving, and men too,
Yeah.
not just for women. The big thing about it is actually trying to help with their nervous system. Because whether you're trying to think about wanting to have a pregnant or you've been trying to get pregnant for a year or so, it's a roller coaster ride, So acupuncture is really helpful for actually balancing your nervous system. So it helps like reduce your sympathetic, which is a fight and flight, and increase your parasympathetic, which is, just completely relaxed in Cabo somewhere on the beach,
Yeah.
So it's really important when our body is feeling relaxed and it's not fight and flight. And like I mentioned, it's going to really focus on the reproductive function, because unfortunately our body is still functioning like it's back in the days when whichever stress, we're either running late for a meeting or we're running away from a tiger chasing us. It can't distinguish the difference.
Right.
So then we're running late for a meeting or even our appointments, our body's like, and then your body is in that fight and flight, and our reproductive function is actually the last one your body is going to pay attention to, because it is not a survival organ, it's a reproductive organ. So your body's going to focus on this heart rate. It's going to focus on liver. It's going to focus on kidneys, It's not going to focus on, hey, let's make a baby while the tiger is going to chase after us and eat us
Really.
and our young,
Yeah.
So one important thing is that everybody could benefit from coming to acupuncture, coming to for trying to get pregnant, is that stress release, that's one big one. And of course, acupuncture is really good at regulating the hormones and helping with their sympathetic system. Then will help with their fertility hormones, and also bringing blood flow to your uterus, creating a better environment for your uterus and also your ovaries. When you're bringing blood flow, it carries oxygen and nutrients, and that creates a really good environment for the growth of the 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 sperm and the egg. I always say to my patients too, I was like, you're actually providing your the health for your future offspring, not just trying to get pregnant right now and have a baby, but you're really giving them the best of what you can give them genetically if you are really taking care of yourself.
I love that. And I love what you said too about like our body doesn't know the difference from our modern fight or flight reason, our stressors that we have, like sitting in traffic, not finding a parking spot, rent is due. Like these are our modern day things that our body's going haywire versus what they were before. And I always say that like we have to be very conscious of what we're doing to create a container for new life to actually flourish. And
I
if
love that.
you're looking at a clock being like, it's time to have sex, and maybe
Mhm.
you're not even into it or you're like dreading it. How is that a container for life or for life to flourish? And if you can get into this space of really trusting in your body, trusting in divine timing, all of the different things, and creating that, the nervous system is the biggest thing, especially for birth, because if that's a problem for conception, it's most certainly going to show up through the rest of the journey if we don't work to regulate that. So I think like what you're creating, that environment for womb health and just the overall body and the growth for the baby. Like all of that is important through the rest of the journey. It does not just stop at conception.
Exactly, exactly.
Well, thank you so much for that. Okay, so now let's move. Let's say somebody's pregnant and they want to utilize acupuncture to help support them through the process. So let's first talk about, first trimester. A lot of people experience lethargy, crazy hormonal shifts, nausea. Maybe some people are just completely hungry the whole time. Like, what are some common things that you see, and what have their experience been like using acupuncture?
With pregnancy, I use these, obviously go through phases for treatment plans. Of course, acupuncture is used throughout the whole pregnancy. And I actually suggested if you're 40 and above and also had challenges getting pregnant to actually utilize acupuncture throughout the whole pregnancy. Of course, it doesn't have to be weekly during the second trimester, but it is really important to just kind of making sure that you're keeping your body at an optimal level in order for your body to really concentrate on building this baby. So but usually during the first trimester, we usually ask the patients to come in like once a week, especially when we've been working through fertility. And that way, to just because during that time is obviously when it's, as we know, most critical. Anything could happen. So that's why we like to keep watch and making sure that your mental state is still feeling balanced and you're getting some good sleep, because you're right, during the first trimester, everybody experiences different symptoms. And even you could have your first pregnancy very different from your second and your third, Yeah. So then with acupuncture, it really helps to just kind of, first of all, again, kind of like fertility, help to regulate your nervous system. So also with nausea, there are certain points that we use helpful for mild nausea. When it's more severe, I would say my success with that is mostly to kind of help take the edge off, not
Right.
necessarily like make it go away,
Okay.
but take the edge off, because they usually still feel nauseous because some women just have hormones that just kind of, really it makes you feel very nauseous, and it just helps really to take the edge off. And sometimes if it's just mild nausea, then you actually really helps with their nausea and also the fatigue and mood, because sometimes you can have first trimester mood disorders, which people don't really know about
Right.
because of like such difference in your hormones changing, your body's changing. I remember my first pregnancy, my first trimester, I would have moments where like things are coming out of my mouth at my husband. I was like, who are you? You're realizing that in your head, but you can't help yourself. And it's just your hormones are just,
That's
and
the
some people
excuse for
actually
people
feel
that
fine.
aren't pregnant and that's happening. Can acupuncture help with them?
Yes,
So
definitely.
no, and what I actually
Absolutely.
love too about what you said is it's not even making it go away, because the body to an extent has to express what it's expressing. It's not a bad
Yes.
thing if you're having symptoms or your body's doing it's supposed to do that. So
Hmm.
how can we bring more comfort? How can we maybe minimize, yeah, like I said, manage the discomfort and minimize it, but not completely trying to make it all go away, because for whatever reason, it's maybe something that's necessary to be expressed. So I think that's
Yeah,
really
well,
view it through that lens.
like you just said, like making them feel comfortable, making it a little bit more easy, is very, very helpful. And also just women that have been going through the fertility journey, getting pregnant is also a very, nervous step, or especially I work with a lot of women that suffer from recurrent miscarriages. So it's very, nerve-wracking sometimes, and you're holding on to the ultrasound appointment every day, so that's
Yeah.
why it's really nice to really have somebody to still kind of hold your hands with while you're going through the first pregnancy, physically, mentally. So I think that's been very helpful.
Yeah, and I think, our brain always tries to corroborate for the past experiences, or what evidence can we
Mm-hmm.
show that, oh, this happened 3 times, so it's going to happen the fourth. And so I just think
Mm-hmm.
anything that we can be doing, like you said, it always goes back to the calming and the nervous system.
Mm-hmm.
But in those situations, even just giving yourself the gift. I mean, you do the best cupping ever in the world. That's my favorite thing ever. But
Thank
even
you.
just giving yourself the gift of having an hour completely uninterrupted and being with yourself and dropping in and connecting. And then
Mm-hmm.
again, because of whether you're conscious of it or not, like acupuncture is going to make the body do what the body's going to do. But like I said, just really allowing yourself to connect and speak to your body, I think is super important. And so when women are experiencing things like preeclampsia or gestational diabetes, or let's say, this is kind of a two-part question. This isn't a complication, but the baby's presenting in breech. So how do you handle, or do you see a lot of women that come in with things like preeclampsia or something like that? And are they ever kind of able to get back down to a normal state so that they can have a natural vaginal delivery? Do you see that ever?
Excuse me. Yes, I do. I think with preeclampsia, it really depends on also your health history coming into, and also how fast we could catch that and how you could really change your lifestyle too. Because obviously it's not just like, oh, your lifestyle, but with preeclampsia, sometimes women just they're predisposed. Maybe their mom had it, whatnot, but as soon as we know, and if women are comfortable with it, I put them on herbs to help with that. And these
Okay.
herbs are safe to take for pregnancy. And actually, these Chinese herbs have been used, for thousands of years. And actually, Chinese herbs were used even before acupuncture was being used to help with women during pregnancy, trying to get pregnant and postpartum. So there are definitely herbs that we use to help with preeclampsia, uh, gestational diabetes, and actually even placenta previa, or
Oh,
even
wow.
lack in amniotic fluids. But you just have to obviously make sure you're using the right types of herbs, and also uh, acupuncture treatments to really help. And there are some cases, of course, where it's just the patient has to do C-section because it just was not helping. Yeah, and that happens. And when that happens, what I really focus is on the after giving birth, because you could have preeclampsia, and then when you are not careful and not treat that after giving birth, I've seen cases where high blood pressure goes up right after you give birth. So that's also really important to know too.
Absolutely.
So yeah,
And
there's a lot of different modalities.
I love what you mentioned too. I dabble in herbalism. I'm clearly not anywhere on the level that you are, but I think there's so many wonderful herbs out there. But it is so important because people, just because it's an herb doesn't mean that, just like anything else, like you can't just pick
Anything.
wild mushrooms out of a forest and, anything has a contraindication. And so it's important to know
Mhm.
what you're doing and why you're doing it, and consulting somebody that really knows, because again, this isn't mainstream stuff. They'd rather write you a prescription or something like that. So understanding how herbs work and which ones and for what specifically you're using it for can be very powerful. So after, talking about things like preeclampsia, which totally makes sense, I would love to ask you about moxibustion, because recently I had a client who saw Jessica and the baby was breech and got moxibustion and the baby flipped. So can you walk us through? I'm not even quite sure what's going on with that, so I would really like to know myself.
It is a mystery. Well, there. So moxibustion is utilizing this herb called mugwort, aye, and this herb particularly helps with qi circulation, so movement, and also it helps with energy. So and actually in Korean spas they do mugwort soak bath to help with
Wow.
circulation, warm your system, warm the uterus. So mugwort is a really actually it's a very great herb to use. So what happens is with moxibustion, we actually burn the mugwort. It's a stick, or there's actually different forms. There's a loose leaf, there's a stick, there's smokeless smoke ones, and what you do is we put the burning mugwort to a point specifically on your toe, on the edge of your pinky toe, and that's an acupuncture point that goes to your uterus. And when you put the moxa stick there, the heat travels to your uterus and helps relax your body, and then helps movement. And that way, it's kind of in a way signals the baby to kind of move around and turn in the hopes of breech. I do have to say though, there isn't a very concrete study on using moxa for breech, but from my clinical experience, I've had a lot of babies turn through moxa intervention along with acupuncture. And sometimes also getting like a chiropractic adjustment to help just open and loosen up, just make more space for the baby. And then getting for the baby to kind of get the signal to move is usually what the moxa does.
Oh, good.
So
Awesome. That's so
yeah.
cool. And what was I gonna say? So I think then, so mock question. So for anyone that's breech, here's a good who has a breech baby. Here's a really great resource for that because there's swimming, there's all sorts of other things, and it's almost like you don't know what's the one that did it. But I love hearing that
Mhm.
that's your own clinical evidence because studies are studies, and I still am always of the mind too of like we all individually weren't involved in studies, so we're all going off of our own experience, and there is no one person alike. So I do love to hear that you've had great success with that because there are kind of limited options even in Los
Mhm.
Angeles, this huge metropolis. You kind of are at the mercy if the baby doesn't flip to have a C-section. It's quite unfortunate, but
I do have to say though, excuse me for interrupting you. Usually when you're trying to help with breech presentation, there is actually a time frame that's the best because
oh
usually like I would say 34 weeks to 36 weeks, even 36, maybe 37 is a sweet spot
yeah.
because after 37, 38, I clinical experience, it's harder to turn the baby because a lot of times too, there's not much space anymore, and then they're just kind of like stuck there in a way.
Yeah,
So
absolutely.
that's why there is always like that sweet spot. So if someone's coming in as soon as like on 34 weeks, they do an ultrasound, it's like, oh, the baby's breech, come in right away, and then let's get on with the treatment because that is definitely the sweet spot where you could really help make a difference.
Oh, that's good to know. Oh, I'm so glad that you mentioned that. Thank you. And then just to kind of wrap this up, I imagine just like everything else that there's a ton of benefits in postpartum. So whether it's the physical recovery, milk supply, any postpartum mood disorders. I mean, that was a big one you mentioned in the beginning that might recirculate later on. So, any tips or anything from a acupuncture perspective that women in the postpartum period should know about how this could be helpful?
I'm such a huge advocate of postpartum care. I think mostly because of I think culturally, our culture really takes postpartum very seriously. Where they have centers where women would go and literally stay there while they are being taken care of to recover,
Yeah.
because it is known that when you have like 9 months of just building and building and building, and then you give birth, which takes a lot of energy, and you're bleeding a lot, you're giving a lot of yourself out. So in a way, you're kind of detoxing a little bit. And then it is believed that when you do that, you actually want to replenish your body with all the good stuff. And that's why a lot of times you hear women that used to have really painful periods or used to have headaches, and after they give birth, their symptoms actually are better.
Wow.
If they've really taken good care of themselves. So postpartum care. I'm actually now. I wrote a book a while ago called "Sitting Moon" on postpartum care, and has a lot of nutrition in there because that is so important on foods that you eat after giving birth to rebuild your body. But now I'm seeing so many more women out there actually are also advocates for postpartum care. Tons more postpartum, food delivery service, and even some centers now that are popping up, and more awareness, more books on it. Because we used to know postpartum as like people think postpartum is postpartum depression, which is
Yes.
not true, right? Because that's what we associate with. So when it's
Right.
like, oh, postpartum, they're like, oh, postpartum depression. So postpartum is actually a period when actually you give birth. It could last anywhere from, right after you give birth to a year, while you're recovering. So that's why it's really important after you give birth, and also depending on your age. If you're 30 or younger, it is much easier to recover most of the time. And if you're, let's just say 35, 40 or older, it is more important for you to make sure like you're slowing down, having people set up like someone to like a doula like yourself to during birth or after to help them recover, and then also maybe food delivery, and then tell people not to visit you unless they
Yeah,
bring you food
me
for the
alone.
first month, you know? And then that way you could really only focus on breastfeeding and then sleeping when the baby's sleeping, and, doing mile walks if you have the energy to, really focus on recovering and food. And in terms of postpartum, uh, some women might experience like postpartum, depression, or actually even anxiety or sleep disorders, lactation issues or mastitis, or tons of bleeding, a lot of bleeding still, or even cramps. So there's a lot of different things that acupuncture and Chinese herbal medicine, that's like, I feel like that's like such a big strength in our medicine that we could help with, because I'm not, I just think that's such a big strength that Chinese medicine and acupuncture could help. Yeah. And you could actually, right after giving birth, 2 weeks after, get acupuncture treatments,
Yeah.
so for recovery,
I love that. Always
especially.
prioritizing recovery after what you just went through. We often just kind of overlook the fact that you just grew and had a baby, and then, everyone wants to come over, you have to get back to doing these things, but that's what's really, really important, and really nourishing yourself, like nice, good, warm foods and everything listed in that. So we'll be sure to include, for anyone interested in purchasing the book, we'll include a link for that as well. Thank you so much for answering all of my questions. If anybody has any more questions or wants to see Jessica, feel free to check out her website, www.renandtonic, that's REN, .com. And then anyone that's interested in any sort of birth-related doula services, you can go ahead and reach out to me, and my website is doulakiley, KILEY.com. Thank you so much, Jessica. We're so grateful to have you.
Thank you.